Hi there, and welcome back to my channel. This is Empowered Health with Valerie Grave. Today's video is Arthritis Part 5. We're going to talk about the pharmacologic treatments of arthritis, including topical, oral, NSAIDs, others, and opiates. Let's dive right in. Hi there, and welcome back to my channel. Today we are talking about treatments of arthritis and specifically pharmacologic treatments. Now, what does that mean, pharmacologic? Pharmacologic means basically drugs, okay? These are things that have been studied and you can prescribe them or you can take them over the counter, okay? But we're talking about drugs here, chemicals, all right? So, the first thing I want to go over here is in the blue. These are things that you can get over the counter, you can buy yourself, okay? Once again, not going to take a doctor's office visit in order to get these. The green are prescription only, okay? So this, one thing I want to talk about is when you go to the doctor with arthritis, you are going to tell them your symptoms. We're going to do x-rays and labs and figure out what kind of arthritis it is. And then this is likely going to be what they run you through. Okay, these are the treatments. This is what they're going to tell you. You may get thrown some of those other treatments that I talked about. You likely won't get told any of the diet modifications. And so I want you, as my patient, I want you to go and try those diet modifications first, because I personally think that these are all a big band-aid. Okay, we are not solving any problems by giving you any of these. All right, if you start on these, you will be on them for the foreseeable future. All right, so that's all I have to say about that. So the first one goes into this category of NSAIDs, okay, non-steroidal anti-inflammatory drugs. All right. And so the first one I wanted to talk about was topical. What's topical mean? Topical means that it's some sort of cream or gel that you are going to rub on the joint and it's going to permeate into your skin, all right? Now, some people think that topical medications are not truly medications, or that you can't have any side effects from them, or, you know, liver or kidney problems from them. But you're wrong, my friend, all right? The skin is going to absorb 60 to 80% of what you put on top of it. And so that is going to get absorbed into the bloodstream. It's going to go to the liver, where it will be detoxed, and then to the kidneys, where you will pee it out. Okay? So don't think that topical anything is not something to think about, right? So topical. So there's two that I put on here. There's lots of over-the-counter ones like Bengay and stuff like that. And those, feel free to try them, but I didn't write them on here because there are so many numerous ones. But the two that you can be prescribed are Diclofenac, which the brand name of Diclofenac is Voltaren Gel. I hope you can read that. My color coding black was, you couldn't really tell the difference between the colors, so hopefully green is working for you. So Diclofenac is in the, Ibuprofen NSAID group. And so if you are putting that on your skin, you likely don't want to be putting any other thing in the NSAID family in your mouth. All right, that makes sense. Diclofenac gel, actually, I find it works very well. So don't poo-poo this one. A lot of people say, well, if it's topical, is it really going to work? Well, actually it does. It works pretty well. So you would just rub it on whatever joint it is that's painful. Typically works for about 12 hours, and then you reapply, all right? And that is by prescription only, all right? The next one is Capsacin Cream. And what is Capsacin Cream? This is one that a lot of prescribers actually, I don't think that they take this one seriously, but I have had a lot of patients who have come back and said, love that stuff, can I get a refill? All right. Capsacin cream is simply hot chili peppers that have been ground up and made into a cream. And so it does cause kind of a burning effect on the skin. And for whatever reason, that really, really helps calm the inflammation of the joint. Fun fact, when you take turmeric, the active ingredient that is causing the anti-inflammation is capsaicin. So if you're going to put capsacin gel on, maybe don't take turmeric. Okay, so next we're going to go into the oral NSAIDs. All right. The first one that we always think of is ibuprofen. Ibuprofen, also known as Advil. All right. One thing I actually want to say before I get into this too much is, of all of these, I don't want you taking more than one of these types. All right. All of these NSAIDs, they all work on the same pain pathway. Taking ibuprofen plus naproxen is not going to do you much good. All right. Taking ibuprofen and aspirin, also not going to do you much good. All right. So stick to one in each group. All right. I will talk about doubling up and whatnot in a little bit. All right. So ibuprofen is your 4 to 6 hour NSAID. You're going to take it orally. The biggest problem that you're going to get with ibuprofen is stomach ulcers, all right? And that is actually a bigger problem than I think people realize. So don't poo-poo that one. Definitely take ibuprofen with food, all right? That helps. And sometimes we prescribe omeprazole with it, which is an antacid. For whatever reason, it protects the stomach, all right? Actually, not for whatever reason. I know the reason, but I'm not going to go into it. So yes, so 4 to 6 hours, take it with food, all right? Naproxen is your Alieve, and that is a 12-hour NSAID, all right? And so all of these are, like I said, non-steroidal anti-inflammatories. And so they're just decreasing the inflammation in the body, which therefore decreases the inflammation in your joint. All right. Next is aspirin, and aspirin actually works for 4 to 6 hours, but we typically only have you take this once per day. Aspirin has a lot of uses, and actually there was an interesting study about aspirin that showed that it decreased the incidence of cancer. So think about that when you think of cancer. Anti-inflammatories help with cancer. Just saying. We're not going to talk about cancer, maybe in a different video, but aspirin is one that I actually really like to use. It is a blood thinner though, and so you need to think about that, but it's easiest on the stomach. They even have enteric coated aspirin, and so if you are going to take aspirin for your joints, I want you to buy the enteric coated. That means that you're not going to have stomach ulcers from it. All right. But I really like aspirin. Okay. If I were to pick one of these, if you're going to take it daily, aspirin would be the one. The next one is Meloxicam. Okay, it is simply just an anti-inflammatory that we can prescribe, and it works for 24 hours. So that's a once-a-day medication. It's one that I really like to prescribe just because of the ease of taking it once per day. And that's basically, you know, it has the same implications as all these other ones as far as taking it with food and stomach ulcers. All right. The last one is Celebrex, and Celebrex is, it's a different type of NSAID, but it is still an NSAID. And one thing to think about with Celebrex that I just want everybody to know, it works very well, and it's used quite frequently for arthritis, but there is an increased chance of heart attack. So keep that in mind. The last thing about all of these NSAIDs that I wanted to talk about was kidneys. All of these are hard on the kidneys, all right? And when I say hard, I'm not saying like don't take them because they're terrible for your kidneys. That's not what I'm saying. What I'm just saying is they're excreted through the kidneys, and therefore they are going to increase the load on your kidneys, all right? So I want you to take lots of water. You should up your water no matter what you do, but up your water when you're drinking these, all right? When you're taking them, okay? So that's NSAIDs in a nutshell. If you have more questions about NSAIDs, go ahead and email me. I'll put my email below. Next is, I just termed it others, okay? If you are looking to kind of do a duotherapy, or these NSAIDs don't do it for you, then these are the ones that you're going to add to your NSAID. All right. And the first one is Tylenol. We all know Tylenol, right? I forgot to write acetaminophen. All right, that's the drug name. Tylenol is the brand name. Tylenol works on a different pain pathway than NSAIDs. And so there is a study, and I would say in my own personal practice, this is true. If you take an NSAID with Tylenol, you get the same pain decreasing as an opiate. All right, and that's pretty awesome because both of these are over the counter, right? They're both blue. Ibuprofen plus Tylenol. So that's something that I really, I just want everybody to take that home, okay? You sprain your ankle, you throw your back out, Tylenol plus ibuprofen is what I want you to do before you ever go to the doctor, all right? See if you can get yourself through for a couple of days before you go and, you ask for an opiate, all right? The next one is Tramadol, and Tramadol is technically an opiate, but I didn't put it under the opiates because it doesn't have the same connotation yet. It is a Schedule 1 narcotic, and so it does, most doctors, if they're going to put you on a Tramadol regimen, they're going to make you sign an opiate contract. They are going to test your urine for opiates once a month, and the pharmacist is going to ask for your ID when you go there. All right. But Tramadol, it doesn't, you can get high on Tramadol, okay? I'm not going to tell you how, but not as easily as you do with the other opiates. So let's talk about opiates, all right? I wanted to have a frank conversation with all of you about opiates, all right? Because you're here, because you have arthritis, or somebody that you know has arthritis, and you may be looking at starting on an opiate regimen. And if I could be your friend, and this is no judgment. This is no judgment zone, okay? And I don't like to make blanket statements because I do think that each case should be considered individually. But my friend, don't get started on opiates, all right? If they are talking about starting you on an opiate regimen, run for the hills. I've seen a lot of people on opiates in my lifetime, and they are good people, okay? And they are in bad situations. But everybody I know who's been on opiates, or either on opiates currently, or have been on opiates and gotten off, have told me they wish they would have never started, okay? Opiate is a drug. It is very similar to heroin. That is why there is a heroin problem in the world, because a lot of people get taken off of opiates and they go on to heroin, okay? So just, one of my instructors said, when you think of street drugs, just know that there's typically a prescription that is similar to that. And so not saying that if you're on opiates, you're on heroin. That's not what I'm saying, okay? Not at all. And I'm not saying that you're a bad person, and I'm not saying that was a bad decision. I'm just saying if you are not on opiates and there is literally anything that you can do to not get on opiates, don't get on opiates, okay? Because I've seen so many people who said they wish they wouldn't have started on the opiates. But having said that, I'm going to go over them, all right? So the two biggest ones are Hydrocodone and Oxycodone. And typically these are paired with acetaminophen. And then Norco is Hydrocodone plus acetaminophen. Some people know Vicodin, and that is Hydrocodone plus acetaminophen, but they actually don't sell that anymore because it had too much acetaminophen in it. So it's Norco now. So Hydrocodone and Oxycodone, they work on the opiate receptors in your brain. Something to know about opiates is that once you take opiates for 3 months, then your opiate receptors, once they are binded and your brain has them binded, but there's still a pain receptor coming, then your body is going to make more opiate receptors, okay? So the longer that you're on opiates, the more pain you are actually going to perceive. And that's why I really just don't like opiates, because they they work very good short term. They're very good for like post-surgery pain, or let's say you know, broke your bone or something like that. They're great for that. But if somebody is talking about, let's just put you on opiates for your arthritis and not solve the arthritis itself, then I don't think that's something that you want to go through.
All right, that's it for today. Thanks again for stopping by my channel and learning about arthritis. If you want to know more about arthritis, you can check out my free online course, which is linked in the details below. If you want to know more about other health topics, please hit the subscribe button. Thanks and have a nice day.